Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. The 3rd of December every year is being marked as International Day for Persons with Disabilities. This year is no different because all over the world, Nigeria inclusive, persons living with various forms of disability, commemorated this day. The government of Nigeria, the federal, states, and even local government levels, in some cases, held series of activities to mark this day. For us on this program, we're looking at access to healthcare generally, for persons living with disability. And of course, it's consistent with the theme of the day this year, which says leadership and participation of persons with disabilities towards an inclusive, accessible, and sustainable post-COVID-19 world. How accessible is healthcare for persons with disability? Are they part of the leadership of healthcare? Are they actively involved in the governance of healthcare in Nigeria and Africa? That's what we'll be discussing today. And I have a guest who is a leading advocate for rights of persons with disability. She is the president of Deaf Women Association of Nigeria and also the executive director of Deaf Women Allowed Initiative. So, yes, I know you can't wait to meet her. Helen Beyioku-Alase is my guest. You're welcome to the program.
Thank you very much.
All right, so we're going to be taking a very short break. When we return, I'll go into the conversation and she will be telling us how Nigeria and, of course, the rest of the world can enhance access of deaf people to quality healthcare. We'll be right back after this break. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, like I mentioned before the break, I'll be discussing with the president of Deaf Women Association of Nigeria, Mrs. Helen Beyioku-Alase, and we'll be talking about how we can improve access to deaf people to quality healthcare. So, Madam Helen, looking at the theme of the World International Day for Persons with Disability, what does it really mean to deaf people in Nigeria?
Thank you very much. It's an important topic. It simply means that everybody, as a matter of necessity, should carry deaf women along with sign language in all aspects of life. They should ensure the full implementation of sign language, thereby no one is left behind in social, cultural, political, and health rights for deaf women. So this year's theme is very, very important. So the deaf women can be able to have a full access to the right. So it's very important.
Okay, thank you very much for that feedback. Yes, sign language is very important, especially at service delivery point. And that brings me to the next question. How difficult or how easy is it for deaf people in Nigeria accessing healthcare, men and women inclusive?
Honestly, it's very difficult for us, my community, to access health care in Nigeria. There's a lot of barrier we have been facing. Communication barrier, attitudinal barrier. I can give you from my own experience. When I pregnant for my son, to access the facility is so difficult. Imagine I leave house early in the morning to the hospital to get a number during the antenatal program. After collecting the number, we sat down from morning till afternoon. And my number has been called, but because of my disability, unable to hear. So you can see how difficult it is. Now, coming to see the doctor, the nurse, the midwifery, how do we communicate? So most times they make a decision for us without our consent. So these are one of the challenges that deaf women face.
Okay, that's really a huge challenge because the National Health Act 2014 makes it in a way that the patient must be carried along in every aspect of the patient's health care, and the patient must be communicated in any language he or she understands. So and Patient Bill of Rights well articulated these rights of patients. So this suggests that deaf people in Nigeria are unable to access this right. So as the president of Deaf Women Association of Nigeria, what have you been doing through your association and of course the larger community of persons with disabilities to improve access to this, to remove this barrier of sign language? Is there any commitment by the government of Nigeria to make persons with sign language skills available as service delivery points?
Thank you very much for this question. It's very important. You remember that health right is very important. In our organization, we have been doing many advocacy to create more awareness so that the barriers that deaf people face can be put to a minimum number. As the president of Deaf Women Associations of Nigeria, we have been able to work alongside with some partners. For example, HIPAS, in some years back, they were able to train 6 sign language interpreters and send them to 6 general hospitals in FCT, whereby they were able to provide a sign language communication to the deaf to break the barrier that the deaf women face, especially when they are accessing the sexual reproductive health rights in the hospital. So I also remember that the Lagos State Teaching University also have employed sign language interpreters so that they can be able to provide a beautiful service to the deaf women over there. So we are still looking up that the government and the policymaker will be able to make sign language as a necessity whereby they can be able to provide more access to the persons with disability. And also in the FCT, we have also developed the sign language glossary, whereby the medical doctor, the midwifery, the nurse can be able to use it to communicate with the deaf whenever they visit the hospital and there are no sign language interpreters. Through the partners, we have also trained some hospital staff in a whereby they can be able to learn a basic sign language so that in that way the attitudinal will be able to change and they can be able to see persons with disability in a good light. And also we hope that we continue to do more advocacy whereby governments, the lawmakers, and other responsible one in the organization will be able to see that this is our right and they will care for us.
Yes, that's really an important advocacy to do to ensure that no one is left behind. I know that persons with disability push strongly for the passage of the Disability Act, Discrimination Against Persons with Disability Act 2018, and there's been concerns about the implementation being very slow. So do you think that implementation of this act could help to remove some of these barriers?
Yes. The heart provide is like a remedy for us. The disability has the implementation. If, for example, in the part 4, section 24 of the Discrimination Against Persons with Disability has make it clear the rights of deaf women to provide sign language interpreters when they are accessing the facility. So I hope if this implementation is now coming up, this can be able to break the communication barrier that the deaf people face in our health facility. And also it will help us to be able to have a sense of belonging by making good use of the hospital, because now many of us does not access the hospital, but now with sign language we can be able to access our hospital.
Okay, so talking about the population of people who are deaf in Nigeria, can you give us some numbers so that as you lead this advocacy, policymakers will have idea of the population we are talking about and the number of persons that are being left behind if something urgent is not being done to improve access to healthcare for for deaf people?
Thank you very much. From 2006, population, we know that we have about 11 million deaf in Nigeria. So now, 2006 coming to 2021, you can see that shows that more deaf from 2006 down to 2021. So we must have a very great number of deaf community, and the research has shown that deaf people, some people through operations, through sickness, they are becoming a deaf every day. So that shows the number now is more than 30 million. So you can see, and because it's one of the hidden disability, you see some people walking on the road, you might not know that they are deaf because it's not being written. So it's a very large community.
Absolutely, it's a very large community, and a community that must be carried along. And of course, that's why Talk Nigeria and AIT is bringing this in, to fore, so that your voices will be heard and nobody will be left behind. So the Basic Healthcare Provision Fund is a policy provided by the National Health Act 2014 that makes provision for health insurance coverage for certain categories of persons. Children under 5 years, pregnant women, elderly people, and of course persons with disabilities to access minimum package of health. Have you at any level engaged in conversation to ensure that people who are deaf are able to benefit from this, or especially some of these funds, 10% of that fund should go into human resource for health? So that aspect could be considered, even though it might not be sufficient, but some of it can be considered to use and hire sign language experts who can be at primary healthcare facilities to, be able to interpret for people who are deaf.
Sadly, deaf community are not being carried along in these provisions. We are not aware of this health insurance because when the information is not being provided in an accessible format, we are unable to know what is going on in the society. So this, we are not aware that there are some benefit that persons with disability, which include the deaf women, as well the men can be able to benefit. So we are not aware of it. We have not been benefit from it. So you can see why our disability is truly a hidden disability. So we decided to carry us along about it. So you can see such type of fund should be made available. So if the communication is very clear and accessible format, we can be able to do that. So I think we also still need more advocacy to the health, those who are regulatory body, as health and hospital is concerned on this.
Okay, that's okay. I'll personally make available a copy of this, the National Health Act, the World Health Systems policy, and of course the implementation guidelines for the National Health Act, so that the deaf community can study it and know areas of the policy documents that you could take to your advantage, or at least do more advocacy to the relevant government agencies to ensure that you are part of every other process involved in implementing the act. So we're going to take another break right now. I've been speaking with Mrs. Helen Beyioku-Alase, who is the National President of Deaf Men Association of Nigeria, and we are talking about how to improve access to quality healthcare for deaf people in the country. So let's take another break and we'll be right back. Welcome back to Talking About Dr. Laz, your favorite health program on television. Yes, in this conclusive aspect of the conversation, I'll be asking more questions to my guest and also the interpreter who has been doing a very wonderful job. So back to you, Mrs. Helen. Now looking at the deaf people with a lot of challenges, the most significant being absence of sign language interpreters or experts in service delivery point. And I'm sure this is not just affecting health. It may also be affecting your right to getting justice and every other aspect of human life. But can you tell us the skills, the capacities, and what Nigeria is missing by not sufficiently involving deaf people in every aspect of planning, implementation of policies, and development? How can deaf people contribute to improving healthcare in the country, beginning from primary healthcare, even to secondary and tertiary level?
Thank you very much for this important question. When there is inclusion on our health system, when our hospital employs sign language interpreters, when our health officers have been disability friendly, when they are being carried along, then no one will be left behind. Started from planning down to the decision making, down to the implementation. So the deaf person have their own unique role to play. So, but if we are not carrying them along, that talent, that skill in them, how do we harness it? And that is why we are advocating that deaf community should be carried along with sign language. It's a necessity, it's our own language. We have experts among the deaf community. We have a lawyer, we have a medical doctor. So when our attitude change toward person with disability generally, including the deaf, then we can be able to say that no one is left behind in all areas. And our policymaker also should, there's a need for them to carry us along all the programs through the sign language, especially in the health facility, the medical doctor. They need to more awareness to them so that they can be able to close the gap, especially they have when it comes to attitudinal changes.
Okay, that sounds very good. So now talking about persons with that have sign language skills, do you have an idea of the population of persons who have these skills? Obviously, we need many of them, but perhaps what we'll be looking at, are they readily available everywhere, every part of the country where you have persons who are deaf? So what's like the number of persons with sign language that we currently have, and what number are we going to need, to be able to bridge the gap and ensure that no one is left behind?
Thank you very much. When I mentioned about the employment of sign language interpreters, it's very important that people show more interest in learning the sign language. Though we have those who are professional in it, and when we know the importance of their services they render to the community, I think it will be a source of encouragement to us to see that there's a need for us to create more interest in learning sign language. And with that sign language, a deaf people cannot be carried along, especially when there is emergency, when there is a risk. You can see the importance of sign language interpreter to be there. So even though they might not be enough, but if we make use of the one we have, then more people can be able to show more interest so that they can learn the language. And it's very easy language to learn. The deaf people are very friendly. We are ready to train more people. So what we just need is for the general public to accept it as our own language. in education institution, we study English language. It's not our own mother tongue. So if you accept English language too, then we should be able to accept sign language as only language for the deaf. So thereby, no one will be left behind.
Okay, that's fine. I really like that aspect. So would you recommend that we could make sign language as one of the language that is being taught in schools, just as you teach English language, we teach our local languages, Igbo, Yoruba, Hausa, and many other languages in the country. So are you recommending that we could have sign language, for persons who are interested to even learn it alongside other languages they learn in school?
Yes, it's also stated in the Discrimination Against Persons with Disability Act. Under the education, it shows that the Ministry of Education have a role to play to include it in the school curriculum. So if we do that, that means in the medical school too, they can be able to include it so that no medical student will pass through the medical school without having a knowledge of sign language. And thereby, we are breaking the gap. And the society, everywhere we go, we can see people who know the sign language. Especially when they started learning it from primary school, secondary school, before they finish university, they have mastered the language. So anywhere the deaf people are, we communicate freely with the society. And thereby, no one will be left behind. So,
okay, so it will really be great to have the Federal Ministry of Education and the various state ministries of education to include this. And of course, we know it's going to take time to have a number, adequate number of teachers to teach this in many schools, but it's something that we really need in order to ensure that over 30 million people, like she said, who are deaf in the country are carried along in every aspect of our development. So lastly, assuming you meet Mr. President today, President Buhari, who signed this Disability Act 2018, after many years of advocacy, what message would you want to relate to him, as regards the implementation, vis-a-vis the various experiences that, deaf people in Nigeria are facing, not only in healthcare, but also in other aspects of life?
if I have that opportunity to meet with President Muhammadu Buhari, I will appeal to him passionately to please make sure that the implementation of Discrimination Against Persons with Disability Act 2018 is being done as a matter of urgency. That way, it will create more access to persons with disability in every aspect of life, and also to make sure that persons with disability are included right from the planning down to the implementation, so that they can be able to harness their talent, thereby making society inclusive.
Okay, so although you are not with the president, but the president, I'm sure, watches AIT and he's going to get this message. So, but looking at the states now, is there any advocacy going for the governors to ensure that this act is domesticated in the 36 states of the country, so that it's not only those in FCT, that will be able to enjoy the provisions of the act? So, is the Deaf Women Association of Nigeria and other groups, of persons with disability leading advocacy to the Nigerian Governors Forum to domesticate this act? Or are there some states that have already domesticated it?
Thank you very much. True, we have some states who have some disability commission, like Lagos State, Plateau State, and Anambra State, and some others. They have disability commission whereby deaf people have access to health care, to employment, and to others. So there's some implementation going on, but we still have more to do. Like my own state, in Anambra State, the governor just passed this to law now, the disability. So you can see So what we just need is more advocacy. In that way, we believe that if all these governors can be able to do that, then it will reduce some of the barriers that persons with disability are having, especially in Nigeria. So we want all the states, actually the wife of the governor, to also take a passionate lead in this, because disability does not know anyone. So we want them to show more interest in this.
All right. Thank you very much, Helen Beyioku-Alase, for joining us on this program and also passionately making those appeals. We believe that the authorities at various levels heard you very loud and clear. And this advocacy is not just for deaf people or people with disabilities. It's actually a responsibility for all of us to ensure that no one is left behind, because if deaf people are not carried along, definitely the society won't be good enough for it. So that's how we end the program today, and I'm hoping that the federal, state government, and all stakeholders, including private sector, that we always bear in mind that we have millions of Nigerians across boards who are living with disabilities, and we must not leave them behind. Thank you for watching. My name is Dr. Laz Eze. See you same station, same time next week. Bye for now.